Hi everyone, I saw a patient who is an 8-year-old Caucasian male who is here for an ADHD follow-up. About a month ago, his parents noted that he was struggling in school, had difficulty sitting in class, and has gotten in trouble at school for being loud, disruptive, and blurting out answers. His teacher has made multiple reminders for him to stay on task, and then he has often turned in assignments late or incomplete. He is in second grade. He's active in basketball and youth group. In basketball, he does well, but he needs reminders to pay attention, while at youth group, he doesn't partake in activities and can be disruptive. At home, he often needs reminders to finish household chores and can't sit through quiet activities without fidgeting. The PCS scale was completed with concerns for inattention and hyperactivity, and Vanderbilt scoring was completed by both parents and teachers. Parents and the first teacher got results combined in attentive and hyperactivity, and the second teacher had predominantly an attentive subtype. His past medical history is really not significant. He only has a history of ear infections in the past, nothing current. He doesn't have any neurohistory such as seizures, neurologic disease, chronic conditions. He doesn't really have any mood disorders reported, such as depression, anxiety, or mood lability. He doesn't have any oppositional or defiant behaviors, and no sleep disturbance or substance use noted. Family history, so his family has some hypertension, and then his dad has some high energy and difficulty concentrating, but never has been tested for ADHD. Like I said, sleep hasn't really been impacted. He's sleeping 8 to 9 hours a night. No new stressors at home. And then parents have been limiting screen time at home. And then on exam today, he's fidgeting and then interrupting. Differentials to consider would be like a language and learning disorder. This would need more thorough neuropsych testing to rule out. We could consider an auditory or visual impairment, but he doesn't present that way. Oppositional defiant disorder could also be differential, but he hasn't been angry, hostile towards others, nothing like that. Depression and anxiety we could consider, but with depression, he hasn't had any changes with mood, low energy, nothing like that. While with anxiety, he hasn't really had any like sleep disturbance, irritability, anything like that. Autism would be another one that we would want to rule out. He hasn't had any presenting factors such as like social disengagement or trouble with interacting with others, so I would not consider this one. For him, a treatment plan, since he's over the age of 6 and he's 8 years old, he would benefit from a combination approach, both with psychoeducation / behavioral therapy and then a stimulant. Psychoeducation and behavioral therapy could consist of educating both the patient, family, and then teachers about what ADHD is and what it consists of, and then treatment plans. They could consider a 504 plan with school to help him learn better, keep a regular schedule, keep distractions low, discipline with positive reinforcement rather than negative, and then using a calm approach. Set reachable goals. You could also set up like a chore chart or a star chart. And then with behavioral, we would want to, again, do positive reinforcement. For stimulant, I would consider doing Concerta because that's a longer acting medication. It would last 12 hours and it would get him through the school day. We would want to give it right away in the morning and by mouth and 18 milligrams per day. It would not be able to be crushed, so that would be one thing we would want to keep in mind. And we could increase that every 7 days or once a week, up to a max dose of 54 milligrams per day with a titration up by 18 milligrams per week. With that medication, we would want to watch vitals. So we would want to watch blood pressure and heart rate and cardiac abnormalities. We would also want to watch how he's growing because it can impact that. It can also decrease appetite, impact sleep. So we would want to consider that along with repeating Vanderbilt scoring to see if he has gotten better or not with moods and behaviors and whatnot. So that is the medication I would pick over the other ones for a benefit. Thank you.